A baby enjoying what has been described as nature's best food for babies, breast milk. The age-long practice of breastfeeding provides infants with the nutrients they need. The World Health Organization recommends exclusive breastfeeding starting within 1 hour after birth until a baby is 6 months old.
It ensures optimal growth, the child grows well, the brain is well developed, there's no diarrhea, and later in life, for the health of the child, there are anti-infection substances that protect the child from diseases. And a child that is well breastfed later in life is protected from some forms of cancers like ovarian cancer, breast cancer, and same suffice for the mother. When a mother breastfeeds, the health is protected. This post-delivery hemorrhage is reduced. The mother is also protected from some forms of cancers, and for the family, it does not cost anything.
27-year-old Mrs. Hawal Bakari's testimony concerning the nutrition and health of a 4-month-old twin babies points at the important role breastfeeding plays in a child's healthy growth and development.
You can see them now. I've already breastfeeding them, so they did not disturb me. It's because they're okay, because I'm eating very well, so that the food that they are sucking in my breast is okay. It's catching them, so I'm very grateful. So they did not disturb me. Then I didn't take them to hospital for maybe treatment or any other thing. Then me too, I'm very happy because they're not crying. If I breastfeeding them, they will sleep. I will walk. Then I can do anything that I want to do in time.
Perhaps lots of mothers desire to exclusively breastfeed their babies, but there are challenges.
I think lack of knowledge is one, because some mothers do come to the health centers with complaints that the milk is not coming, the child is not feeding well. Number one, when there's late initiation, it's a great challenge, because the initiation will bring up the reflex for milk production. So the earlier the child is initiated to breastfeeding, the earlier the brain it's receiving message that it's time for action, and the milk will come up and it will flow. Then positioning and attachment. Many women don't know much about positioning and attachment. If the child is not well positioned, the child will be latching on the nipple and not the areola. And when the child is latching on the dark area of the breast and the lips cover that dark area, it will encourage the flow. The milk will flow well. Because when you talk exclusive breastfeeding, after 3 months, the mother has to resume at work. And in some workplaces, in the government, maybe they close by 2. In some workplaces, then they don't allow it. But we still say it is still not a challenge. The milk can be expressed by this mother. Only you need someone that has knowledge at home. When the mother expresses the milk, this milk can stay for 8 hours and nothing will happen to it. Even if you don't put it in the refrigerator, you just ensure that you keep it in a covered cup and the cup feed the child. We don't want bottle feeding, because evidence has shown that bottle feedings encourages bacteria and diarrhea.
For the mothers to be able to lactate well, number one, nutrition comes in. They must eat accurate, good diet, which contains both carbohydrate, vitamins, and protein. Because these little children, these 4 children, depends on what the mothers have in them. There should be enough drink for the mothers. Let them drink enough of water. If some could drink ogi, that is pap, let them take pap.
We are happy with the new law in Lagos State, where the governor has been able to extend the maternity leave for mothers to 6 months, and then the paternity leave for the fathers for 10 days. This is laudable. This is commendable. The theme last year was breastfeeding support close to mothers. We've been asking for support from policymakers, from the community, from the family, and this is a good step in the right direction, because with this period now of 6 months, the mothers can stay back home and breastfeed exclusively. And we're looking at a situation where the private sector can also buy into it. Other states in Nigeria can do the same, and even the federal government as well can bring up the law so that mothers can spend more time with their family.
That breastfeeding has scientifically proven health benefits for both the mother and child is not in doubt. Continued education during antenatal period and support by family members and, of course, baby-friendly policies will help in the sustenance of this crucial nutritional need for babies. Yomi Otaigwe reporting for Channels Television News.